Dr. Amy Sanders Bekanich, a board-certified plastic surgeon with Westlake Dermatology in Austin, Texas. I want to welcome you today to our virtual event. We will be talking about things such as breast augmentation, breast lift, and breast reduction, and all breast surgical procedures.
And I am Dr. Atencio. I'm also a board-certified plastic surgeon with Westlake Dermatology. And I would like to encourage you all to stay until the end of our virtual event so that we can answer all of your questions. We will be able to do that live. You can type them in and we'll answer those for you. Also, we have a fantastic discount. It's going to be $1,500 off any breast procedure with Dr. Bekanich and me. And we also have a giveaway for one lucky winner that will get TNS Advanced Serum.
At Westlake Dermatology, we will all be here to guide you through your surgical experience, from the moment you have your first consultation until your very last appointment. Myself, all of the nurses and support staff, we're here to make sure you have all of your appointments and your medications to answer each and every one of your questions. We're here for you. It's a personalized experience where quality is much more important than quantity. We're here today to talk about the variety of breast surgical options that we offer at Westlake Dermatology. And these include such things as breast augmentation, breast lift, breast reduction, a combination of all those, or even secondary breast surgery.
All right, so breast augmentation. In a breast augmentation procedure, basically what we do is augment, add volume to what you already have. There's different kinds of implants, there's different profiles, and we're gonna walk you through the entire decision process of where to put the implant. Does it go under the muscle, over the muscle? Where do we make the incision? There's different ways that we can do this procedure to achieve the goals that you want. Ultimately, it's your choice if you want them a little bit bigger or a lot bigger. It's all gonna depend on what your goals are and what you really wanna see in yourself.
Another procedure we offer is a breast lift, also called a mastopexy. So why would someone want to have this done? Well, typically what I see is patients who, through time, have lost a little of the integrity of their breast tissue, and the breasts have descended down and they don't fit well into clothes anymore, bathing suits, particularly dresses, and they just really want to kind of revive what they had before. Oftentimes this happens also after a woman has had children. So with a breast lift, what we do is do a variety of options of surgical procedures just tailored to what your breast needs. And with those surgical options, the breast is lifted, some of the natural breast is removed, and you can actually combine that either with your own tissue, with fat grafting, or with an implant.
At Westlake Dermatology, we're all board-certified plastic surgeons. That is something that matters, and it is important when choosing who to go to for a procedure that is going to be in your body, that it's going to be changing your life. So you want somebody that does it in a safely way, and that is a board-certified plastic surgeon. So here at Westlake Dermatology, we are here to help you.
Welcome to Westlake.
Thank you.
How's your day going?
It's good. I'm excited for the consultation.
Yeah, we're really happy to have you here.
Thank you.
So, just looking at your health history, everything looks like you're a healthy person, no problems, heart, lungs, kidney. All right, and my understanding is that you're here to discuss some breast work. Yeah.
Yes.
Okay.
Yes. So
why don't you tell me your goals?
I want them to look a little bit perky. I have 2 kids, and I think after breastfeeding them, they kind of went down. So just a little bit of augmentation and kind of making them look a little bit more perky.
Okay. And then would you say that you're an athletic person, and that would be something that would come into play with things?
So I do work out here and there,
Okay.
but I'm not a huge athletic person.
Okay. And I just ask that because it comes into play when some people are, putting on the sports bras and they're out there and they're running a lot around Town Lake or something, and they're kind of hitting if it's too far out. So we want to take that into consideration when we pick the sizing.
Okay.
Do you have any trips planned soon?
No.
No? Okay. That's one thing you're going to want to be thinking about when you decide to go on your journey. You want to be thinking about doing it when you have time to devote to yourself so that you can go through the healing process, so that you've got help with your kids, you can stock your fridge ahead of time, have your house cleaned, all those kinds of things to really put yourself in the best situation. Sitting job, working on a computer, it gives you a lot more flexibility with that. We've definitely known a lot of girls in our clinic who've had augmentation, and they're back to work within like 3 to 4 days.
Okay.
So it is possible. You're not 100%, but you can do it. But in terms of what things that you need to kind of trim down for, it's about 6 weeks. Okay. And during that time, showers only, so you want to eliminate the swimming or hot tubs, any lake water, things like that. Exercise, where you're getting your heart rate up for about 2 weeks, 2 to 3 weeks. You want to make sure you're not doing that. And then after that, it's more just not doing things that are going to be pulling and engaging those muscles up there. And we want them to just kind of settle nicely. And anything that you do, like carrying heavy groceries or a heavy purse, something like that, can kind of pull them up a little bit. You come back at 1 week, we show you how to do massage. And then after that, 1 month, and then 3 months. Okay, this is very exciting. Okay, we're going to get you into a gown now and just have a look to see where you are. All right, so go ahead and put this, open up to the front. And I'll be back in a few minutes. Okay.
as we will be notifying one of you the winner of the giveaway of the TNS Advanced Serum, which has a $295 value.
Check your text messages as well, because that's how you can book your consultation. And remember, you get $1,500 off if you book a breast surgery with Dr. Atencio and I.
And please stay with us for the next 15 or 20 minutes. Chat with us through the question box, where we will be happy to answer all of your questions. Thank you so much. Hello, everybody. I hope that you can hear us. I hope that you enjoyed the video that we had for you. And I think that we're going to start with our Q&A. I'm Dr. Daniela Atencio. I am a board-certified plastic surgeon for Westlake Dermatology at the downtown location.
And I'm Dr. Amy Sanders Bekanich, and I'm a board-certified plastic surgeon at the Domain location.
So we are going to start with the questions. And the first one, it says, are there things I can do prior to surgery to help with my recovery? And yes, healthy diet, no alcohol, not taking anything that can make you prone to bleeding, like aspirin, ibuprofen, stuff like that. And then there are certain supplements that I like, arnica and bromelain. They help with bruising and swelling. So you can start actually taking those a week or two before the surgery and then after the procedure as well. Do you have anything else?
Yeah, the only thing I would really add is just to kind of set yourself up for success. So, have your surgery when you're not planning a vacation in 2 weeks afterwards, right? Or right during the holidays where you're expected to host everyone. Just kind of think through the planning, think through how you're going to take care of your kids, work, expectations, things like that, because we want you to be successful.
Absolutely. I agree 100%. I also tell patients, like, maybe minor details, like get the house clean before, let the laundry ready, so you don't have to worry about that first week. And if your bathroom things are up, then bring them down so that you don't have to be reaching for things that you use on a daily basis.
Yeah. Meal prep, and I always say,
get
your nails done, even though I'm probably not supposed to say that, but I always say that too.
The anesthesiologists are probably like, no.
Yeah.
Oh, perfect.
So our next question is, what is fat grafting, and how does that differ from an implant in terms of the aesthetics or how it's going to look? So when I speak with patients about that, so number one, what is fat grafting? It's taking fat from another area of your body, putting it through a process, and then injecting it into the area that you want to augment. Usually it's making more full. How does that differ from a implant surgery? It's really just the look. I mean, it is definitely the recovery as well. But I think the most important thing for a patient to think about is what look you want. With fat grafting, you don't get quite that rounded fullness at the top that I think a lot of my patients who come to see me are really looking for. It's a little more subtle. You do get some fullness, and it's perfect for someone, though, who has lost a little bit with kids or just in time and just wants to bring things out a little bit. But if you're looking for something much more robust and to really stand out in a party, the fat grafting is probably not going to get you to where you want to be.
Absolutely. I agree. I think shape is very important. Natural breasts are flat at the bottom, flat at the top, fuller at the bottom. And that's what fat transfer is going to do. It's going to keep the same shape, the same location of the nipple. It's just everything's going to be a little bit bigger. And how much bigger? It depends on how much fat we have. So a good goal is up to a cup size bigger. If you wanted to get more than that, you might need to think about doing 2 stages of fat transfer. But it is good for patients, for example, they don't want to have implants. Yep. They don't want to deal with implants. They don't want to have another surgery in their lifetime. They just want a little bit more plumpness, a little bit more fullness. They're okay with getting that cleavage with a bra or with a swimsuit, and they rather be very natural. So fat is going to be very, very natural.
So all about expectations, for sure.
Next question. Let's see. Sorry. We're going to have to scroll.
And everybody, please don't hesitate. Put your questions on here. This is the time to do it. We are here.
We're going to answer everything and straight to the point, all of the details. This is the time for that learning, to get that information, right? Anything you can think of, put it in the box. Next question. It says, how long is the healing time after a lift? So a lift is a little bit different than breast augmentation, but it depends. You can also combine those procedures, right? You can also do augmentation and a lift at the same time. As a general rule, it takes about 6 weeks for those scars to be strong. So nothing upper body, pushing, pulling, anything heavy for 6 weeks. However, it depends on the size of the lift, if we're combining it with an implant, what the short-term restrictions are. But overall, about 6 weeks for full, going back to normal activities, going back to the gym, all of that. Pain, I think maybe like 3 to 5 days. Yeah, the first week for sure, take it off.
Yeah,
give yourself a time.
Yes.
Take your time to heal that first week. If by the third day you don't need any more pain medication, fine. But you have that time extra to kind of rest and heal from the procedure.
Yes, I would agree with that. And then the next question is, when doing a lift, you have to do an implant also. And just like Dr. Atencio was mentioning, you can combine the procedures or you don't have to combine the procedures. It really kind of is based on what your expectations and what you are looking for. So when you come in for a consultation, obviously we look at your exam and talk to you and figure out what you're looking for. And then also try to figure out what your breast is at this time that we're seeing you and what it can do and what we can do to make it look the best. So if you come in and you have very, not a lot of breast tissue, but you want things to look more lifted, more rejuvenated, more elevated, then I'm probably going to encourage you to get an implant as well. But if you come in with very full breast tissue up on the top and you just want things kind of lifted because things have gone down over the years, then we might be able to just do it without needing an implant. So it kind of depends, again, what silhouette you're looking for and what your expectations are, and also what your lifestyle is like.
I agree. And also you can combine it with fat transfer. So not only an implant, but you can also transfer fat to that upper pole for a little bit more fullness. If you don't want an implant, you can still do a little bit of liposuction, usually on the sides, usually in the tummy. We have a little bit extra, and then we move it to where you need it, right at the top where we lose it. So you can also combine those procedures. Perfect. Next question.
The lollipop, the scar. This is one of the biggest questions we get, right?
Yes. It says, can you get a breast lift without the lollipop method? And depends, right? So there's a type of lift that is only around the areola, and it has a scar around the areola, or maybe a crescent. Those types of lifts are limited to moving the nipple just a centimeter, maybe 2, but you cannot really achieve a lift of the entire breast tissue by just making an incision around the areola. Sometimes, and most of the time, patients really need to reposition all of that breast tissue higher in the chest. And in order to do that, we need to remove some skin. And that's where the lollipop comes in. The lollipop can turn into a J or a full incision at the bottom as well, depending on how much we have to lift.
Yes, I agree with that as well. I think when I'm talking to patients, one of the main things that I want them to really come to an understanding for themselves before they go forward is scar, or how is the breast going to look afterwards. So for most patients, when things have kind of gone down with time, most of the part of the breast that they're not really liking anymore is on the bottom part. And so just taking a little bit of tissue around the nipple is not going to address that. Plus, over time, that scar has a tendency to widen. So it's really not my preferred thing. So I know the lollipop is kind of hard for people to really accept, but in order to get the best breast shape afterwards, it usually is what we're looking at. And over time, I mean, that scar, that it does fade. And especially with Westlake Dermatology, we have a lot of modalities to help with scar healing afterwards. So I wouldn't let that be the thing that kind of keeps you from going forward and thinking about things.
And I don't know if this is your experience, but in my experience, that vertical scar that goes up and down is the one that fades the fastest. So it's the first one to fade, but it's the one that scares people the most. It fades, it's gonna blend in, it's gonna be good. You just want round, perky breasts, right? At the end, it's about shape. And if we don't make incisions, then the breast can look elongated, can look like, the nipple is higher, but the breast is not so round. So compromise.
Exactly. All right, so our next question. They already have a breast aug, but feel like they're bigger than they wanted. One is bigger than the other. Walk you through how that works to reduce them, I guess, or make them more similar. It sounds like it's a revisionary procedure, and really for all revisionary procedures, we kind of have to see you, number one. But in order to get them to be more similar, what you're looking at is either making one larger or making one smaller, and so it's a secondary breast augmentation. Usually through, if it's a incision that was in the fold, through the same incision that was done before. We're going to be looking at whether or not, have things stretched out? How long has this?
Yes, I was going to say, how long have these implants been in there, right?
And
are we going to change both, or are we going to change one?
Right. And, do you need a lift at this time? And so there are a lot of things that will come up that we'll discuss when you come in.
Yes, and it depends about volume, right? Did you get 600 cc's and now you want 200? That's a big difference, right? So, or did you get 300 and now you want 250? Different conversation. So it's going to depend on the details, exactly what the recommendation is going to be.
Exactly. This is my favorite one because I always...
Then you go take it.
Yeah. So someone's wanting to know how much time would an out-of-towner need to stay in Texas? And I really feel that when you have your surgery, the best thing for your outcome, I mean, you're paying money for this, you're taking time off of work, you're setting up your whole world for this surgery, and you want to get the best outcome, that you want to be here like a month, really. I mean, that I know a lot of doctors will say no, but that is my thing, that if you can, you're here. If you get through that month, everything will be golden, in my opinion. But if you start to cut corners and leave shorter time than that, it's really hard for me to get you your best outcome. I mean, it happens. Don't get me wrong, but I prefer you to stay.
I'm totally different.
That's great. That's great. Yeah.
And that's a beautiful thing about plastic surgery. Everybody does it differently. We feel comfortable with different things, right? And to me, it's first, what procedure am I doing?
True, definitely.
Breast augmentation with a small implant. Yeah. Young person, that's healthy person, we're a little bit more lenient. Small lift that doesn't have fat transfer, that doesn't have an implant, that maybe, right? So I always say patients 1 week. 1 week you need to be here. That first week is the most important. I don't want you lifting things, dropping your bag, and then you pop a stitch. Definitely not for the first week. And after that, it depends. Are you gonna get on an airplane for 9 hours, or are you gonna drive 2 hours? Mm-hmm. So those are different things as well. If you live close by, you're going to travel by car. It's a little bit easier, right, than going through the airport. Mm-hmm. If you're going to be in the airport, maybe 2 weeks is safer. I think that after that, we can do some of your appointments online, and we do this a lot. We have like a virtual appointment where we can follow up for certain parts of your recovery, but we will ask that you come back, because we will have to see you in person. And then know that if anything happens, you have to be here because we want to fix it.
Exactly. Yeah. And so I absolutely agree. Yeah. Breast augmentation, liposuction, kind of the simple things, no problem. But when we're looking more at a full breast lift or a tummy tuck, something like that, it's really good to be able to see you.
Yeah. All right. Next person says, I've had a consultation, but we didn't discuss profile, and I'm uncertain of the exact size I'd like to go with. What next steps do you recommend? So when you come in for a consultation, we're going to take measurements. I like to talk about implants in terms of math. We're going to find something that is going to fit the measurements of your chest, and after we take those measurements, then we put you in a different profile based on what your ultimate goals are. Do you want to be super natural? Do you want to be medium natural? Do you want to be natural plus? Do you want to be round? Do you want them to be there and not move and not ever wear a bra and have that roundness on top? Whatever you want, we're going to guide you through that process of what impact profile is going to fit your expectations the best. And then within those parameters, we'll let you know, this size is the size in this profile that fits your chest. And it's all trial and error. You're going to try them on. You're going to see how they feel. You're going to see how much they weigh. We also give you like a little t-shirt. You can kind of imagine yourself wearing them. And that can give you a little bit more of an idea of the ultimate result.
I would agree with all those things. I definitely approach things from a gestalt in many ways. So I like to really look at patients' shoulders, where they kind of hold their weight, the width of their chest, and then how each person's breast tissue sits over what we call the footprint of the breast, because different profiles will look better on some people and not as good on others. The other thing, when you're thinking about it beforehand and when you're sizing in the consultation room, looking at how they're fitting on you that we're sizing, and then how does it look when they're kind of out? So you have more side breasts versus not. Are you athletic? What kind of dresses do you wear? For me, all of that kind of plays into it. And then anytime I do surgery, I'm just notorious for, I have lots of different options. I like to size everyone, sometimes even different profiles, because I like to see what it looks like on you, because everybody kind of looks different once it's inside. No matter how much we see beforehand, it kind of looks different inside.
For sure. I agree. I do the same. I always try them on in surgery. You want to see what it's going to look like. And you said something that made me think of something, and now I forgot. If I remember, I'll get back to you. But ultimately is per person. Oh, I was going to say, we also have pictures available during the consultation time where I will sometimes show you what an exact implant is going to look in different people. And you'll realize that the same implant is going to look so different in each person, just based on how much skin there is, how wide their chest is. So it's important for you to understand that, right? Now, my friend got a 350 HP. I want a fat 350 HP. It may not look like that. It may not look the same. So it's important to kind of let us guide you to what is going to get you to your goal based on your own anatomy, because it could be a different number. It could be a different profile.
Yes. A lot of those are the math parts.
Yes.
Kind of the math sets the stage, and then we go from there, really. Yeah.
Perfect.
Let's see. The next one, can a fat transfer provide enough volume? So I think we kind of touched on that before. Volume. Can it provide enough volume? Well, what kind of volume are you looking for?
What is enough?
Right.
What's
That's
enough
the
for
question.
one person might not be enough for another person.
Yeah, I think for most for people who I've spoken with, that they want augmentation, right? Fat transfer is probably not going to get them there. Okay. If they want to gain a little fullness on top, kind of perk things up just a little bit, then I think that's going to get you what you're looking for.
Yeah, I think basically up to 1 cup size.
And it depends on the person, right?
Yeah,
Tight
and
skin.
and it depends on how much fat there is too. Because if you're 90 pounds,
Yes.
can we get that much fat? Can we inject that much fat? Also, how tight that skin is. If it's super tight, we could have all of the fat in the world, but it's just not going to fit in there. I try to use the analogy of fat transfer. It's like filling up a donut. There's only so much space. You're going to put the fat in there. Eventually, it's going to get filled, and it's going to start coming out of that hole. Same thing happens when we're trying to do it on the breast. There's only so much space. There's only so much it can fit. And after that, some of that fat is going to get absorbed. Fat absorption is different for each person as well. If you're older and your fat cells are a little bit older, so those fat cells don't tend to survive as good. Where are we taking the fat from? Usually the belly and the inner thighs is the best fat, the best buttery fat. So that fat kind of survives a little bit more. So there's a lot of variables. And I think the perfect candidate for fat transfer is a person that is open-minded to their results. Because nobody can control the exact result. Not the patient, not the surgeon. We get as much fat as we can. We inject as much fat as we can. And we just hope for survival. So that's why I say it's a little bit unpredictable. It's great in the end if that's, if you achieve your goal with fat transfer, because you don't have to worry about it anymore. But it's definitely an unpredictable kind of procedure.
And I think also that touches on what we were mentioning before, setting yourself up for success. So, you will retain more fat in general if you are healthy, if you are taking care of yourself, if you're metabolically in a good position, not stressed. So setting yourself up for success, again, is key.
Absolutely. Same. Smokers.
Yes.
If you use any nicotine products, I would never do fat transfer. Fat doesn't survive. It doesn't survive. I haven't seen really good results. So that's another thing. And maintaining a healthy diet post-op. You need to maintain your calorie intake. If you're trying to lose weight because you just got lipo, your body's going to eat out that fat. So it's just about all of those things.
Okay, so how do you choose where to pull fat from? I think you just touched on that. The best place is the abdomen and the inner thighs, but obviously, we can get fat in other places. But that's probably the fat that I think just historically and in papers that really has a tendency to stay the most to get the best results over time.
Wherever there's fat that we can lipo, we can transfer.
Yeah.
But how much, how healthy that fat is a little bit different for different parts of the body.
Yeah. And one thing on that too, I think it's important is that, so when someone comes in to talk to me about that, so anyone can liposuction you, right? But what are you going to look like afterwards? So you can take tons of fat and then the skin can get kind of funny afterwards.
Yeah,
you don't really pay attention to how much, to leaving a certain amount there. So that's a really important discussion you need to have with your physician, is making sure that what they call the donor site, the place where you get the fat, is going to look beautiful as well at the end of the procedure.
Yeah, you don't want to make it something ugly just to make something else prettier, right? So you need to remove the fat where there's an excess and where you're actually going to improve the aesthetics of that part of the body as well as the breast. On average, what is the longevity of implants? Well, the manufacturers, they say it's 10 years and then you have to change it every 10 years. Surgery has risks. So I tell patients there's no need to take a risk if everything is okay. So if your implants are good, you like the way that you look, you like the way that they feel, then, and they're not ruptured, obviously, then you can continue until one of those things happen, until you want them bigger, you want them smaller, you want them lifted, or one of them ruptures.
See, and I take a little bit of a different approach in that I feel that when I'm thinking about the implant, it's something inside of you that is aging, just like everything else in the world, and it's getting older. And my experience with patients that come in who've had surgery in the past, with other providers, other places, or even my own, but they come in, and if that implant's been in there a long time, it's old. And eventually on some people, their body's going to be like, this is old, and then potentially go into more of a reactive stage and start making the capsule that's around the implant thicker. And then that can get into a really expensive surgery. So if you're around, what I say is if you're around that 10 to 15 year time, then that's probably in that range is a good idea to change them out, in my opinion.
Absolutely. And I think that, yes, if they start feeling thicker, if you start having any symptoms, if most people, in 15 years, your body's going to change. So things are going to change. They're not going to look the same. So you can't, go ahead and change them. I think that's pretty much.
Yeah. Where do you perform surgery? Yeah, so I perform surgery at a surgery center called Westlake Hills Surgery Center, which is over in the Bee Cave area. And then soon I'll also be performing surgery at the Lamar Central location. And that's for the breast surgeries, any of the general anesthesia.
I am in downtown Austin, next to the Four Seasons Hotel, East Cesar Chavez Street.
With great parking. Don't let it fool you.
There's parking in the Four Seasons residences, so don't think that you have to go park on the street. It's very easy. Just bring your ticket, we'll validate it.
Let's see. Breast implant revision. I'd love to know your process. Implant revision. So really that is someone coming in and we need to see, where are you? Does everything look exactly like it did when you first had your surgery? You don't need a lift. Things don't need to be a little perkier. Your expectations haven't changed. All those kinds of things are taken into account. So if you don't need anything done, then it's going through the same incision, kind of taking out the original incision scar so that you have nice fresh areas and nice pretty scar, and then taking out the old implants, double checking, making sure everything looks nice and perfect, and then putting in new implants. Now, if you've had some drops since then we need to talk about a lift, and that's a whole nother thing. Or if you have something wrong with the implant, that's a whole nother discussion. So really it depends on your expectations, what you're looking for, which we all discussed, and then what your physical exam is.
Yes. If it is just symmetry, we can switch one out. If it is size, then it depends. And if it is look, then we can talk about like additional procedures. So it's all gonna depend on specifically what you're looking for. Next question is, can you do a breast lift without changing that areola size and shape? Size and shape? I think so, yeah. If you have a normal size areola, we're gonna keep it the same size.
Yeah. Most people don't. Most people, it's stretched out and they're
exactly.
They're
it's
looking
weird
for
that
it to be smaller.
Yeah.
But I would say in some circumstances, it's pretty rare. But some people, their areola and such are in nibbler is in a perfect place, and so you put in the implant, but they have like glandular ptosis at the bottom, and so you actually don't get that necessarily. Have to have that scar around and down. We can just take like a little crescent, like a little moon at the bottom. Not very common, but that can happen, and then we wouldn't be touching your areola. So that's possible. But in general, we usually do, yes.
That's true.
And it's not taking the nipple off, right? So some people have this idea that we're removing the nipple, but it's still being attached. It stays attached to the main bulk of what we're keeping with your breast. And so all those nerves and the sensation and things like that, our goal is to keep that as intact as possible.
Next, do you sit patients up during augmentation to see if the goals is being achieved? Yes, multiple times.
Yes.
How about you?
Yeah, I absolutely do. And I think most people do, but I was just actually reviewing some videos from a conference that I had gone to, and some of those people don't. And
some people don't.
I don't know.
Yeah, I know a few.
I have to. I just really feel that.
Yeah, I'm paranoid.
I don't feel good leaving the operating room unless I am looking at you and I feel like we're on the same page of what you were wanting.
Actually, I print the patient photo, I print their inspiration photo, and I sit them up, and not only I compare implants, but I also compare them to that photo that they want, and make sure that we can get as close as possible. And even if there's perfect symmetry, and we know exactly what we're gonna get, I still try different things.
Yeah,
just to make sure, just to convince myself that is the perfect match for the patient. So yeah, I sit them up, I try things on. I like to know for sure. How do you help a patient choose the right size implant?
Yeah, talking to the patient, what their expectations are, what their lifestyle is. That's super important to me. One thing I really like to talk about is, okay, are you looking for more like a Miami voluptuous sort of figure afterwards? Are you looking more for a dancer's figure? How active are you? How important is it when you're in a bathing suit to have a certain look versus another look? And then after that, it's just measurements and then looking at your breast tissue to see what will work best.
And inspiration photos. We kind of brushed into it, but inspiration photos help because they help us see what you see. Mm-hmm. And I think that's a really nice tool. You just pick someone that you like, bring it for a consultation. That will help us guide you and being like, well, for your body type, if you're going to get here, these are the implants that are going to look more like that.
Yes,
what do you think?
Absolutely. Yeah. Because when I always see someone comes in, I want to see. Well, what does a C mean to you versus what does a C mean to me and your body? And so it's very eye-opening sometimes.
Yes.
When someone brings something, I'm like, you know what? That's actually a double D. So
Yeah.
are you okay with that? And you know, do you have back pain? We need to talk about all those kinds of things. But
Yes.
just getting on the same page with a photo, very important. Yes.
Yeah, and also please don't focus on the letter. The letter doesn't
Yeah.
matter.
Mm-hmm.
I tell patients the letter doesn't matter as long as they look good and you like them. Nobody cares what letter that is. So don't focus so much on the ABCs of breasts. All right.
Go back to work. How many days?
Yes.
Okay. So how many days after the surgery can I go back to work? Depends what you do. So I would say the soonest really is 3 days, and you just don't want to be on pain meds. So if you work at a computer, you don't have to be doing a lot of handwork, that kind of such. Then I think it's fine to go back after 3 days. But if you are a bartender or a waitress, or if you work in a daycare and have to pick up little kids, or if you yourself have a child that you have to get out of a crib, that kind of thing, then it just changes things. But in general, like 3 days to a week.
I agree. I think as long as you're not taking pain medication,
Yeah.
depending on your job, if you work from home and on a desk and you don't need pain medication, because pain medication makes you brain foggy, so you really want to concentrate. As long as those things are met, you can go back to work. Next is one of my patients. I love it. She said, I had a fat transfer just 9 days ago by Dr. Atencio, and I'm very happy with how much fuller they look. My question is what to do when hopefully years from now things start to sag. And a second question says, can I do pectoral exercises? So when things start to sag, we can do a lift. I don't think necessarily things always sag.
Yeah.
Some people are very lucky and they can live their life without needing a lift.
Absolutely.
And that depends on skin quality. If you have nice, thick, healthy skin, you might get away without it.
And weight changes too.
And
I
weight
think that's
changes,
very
yes.
important to
Yes.
keep
So
in
if
mind.
you like gain 20 pounds, lose 20 pounds, gain 20 pounds,
Especially
lose
with
20 pounds.
pregnancy.
Or pregnancies, multiple babies, things change a lot.
Yeah.
Stretch, all of those things. If that happens, then most likely we can do a lift later on. Or a lift and an augmentation if you want more volume, or if you lost some of the volume, you can then get an implant. But that's basically it. And then can I do pectoral exercises? Yeah, you can do pec exercises. I don't know how much that helps to keep
It helps
things
a
hot.
little. I think it, you
Yeah.
know, it's more in this area, but
Yeah.
I think it can. You know, it's just like gluteal exercise.
It's not gonna hurt.
It's just something.
So definitely you can do pectoral exercises.
The next question is, are you able to get a brachioplasty, which means getting an arm lift, so skin removal and some fat removal, with implant surgery, or would you need that to be 2 surgeries? So I think in general, yes, you can get those at the same time. If you are a person that's had massive weight loss, so it's a really big surgery on both accounts, then maybe you'd want to split it up. But in general, you can do both, yes.
Absolutely. As long as it's not too long or too extensive.
Yes.
There's different kinds of brachioplasties. Brachioplasties that kind of come all the way down. Maybe it's not an augmentation, but a lift, and then you're kind of combining scars. Sometimes some people are not candidates for that. But in general, yes. I mean, they're both fairly quick procedures. So they could get, and you're going to have the same sort of restrictions.
Yeah, so that's helpful.
So that's helpful. Yeah. You're kind of healing this part of the body. So, yeah. How does a breast lift affect a mammogram? I think in the short term, right after surgery, things are going to be inflamed. So you really don't want to have a mammogram or an ultrasound or anything like that within a few months after surgery, because things are going to be inflamed. And there's tissue remodeling, fat remodeling that happens underneath, and that takes time. Other than that, they can if fat cells can die and they can create calcifications. Those calcifications can be seen in mammograms, but they're usually distinguishable from actual problems. So the types of calcifications that happen with when tissue doesn't survive or creates like a little cyst or whatever, it's very different than something that you would need a biopsy for example. So they're able to identify types of microcalcifications, worrisome calcifications for cancer versus just calcifications from tissue remodeling.
And the only other thing I add about that to patients is that, if you are getting your mammogram in Alaska in the middle of nowhere and they don't really see women that are, they're not experienced enough, then maybe there would be an issue with that. But in a normal city, they see tons of patients who have had breast surgery. And so I really think that nowadays it's not as big of a deal at all.
And I'm going to go ahead and patch this in. They didn't ask us, but a mammogram with implants, it doesn't affect your diagnostic potential. The implant most of the time sits underneath the muscle. It pushes all the breast tissue forward. They just have to do a specific like shots from different angles. So you just tell them that you have an implant and they just take those extra pictures.
What's that? Let's see. The scarring of fat transfer. Okay, so for the breast, kind of depends on where you need the fat or where you're going to be putting the fat. But in general, we're putting them on the upper portions. So if you are all over getting fat placed in the breast, then you're going to have little teeny tiny incisions in the areas that you wouldn't want to have exposed for a bathing suit or something like that, because everyone's skin's a little different, and just in case it has a little dot that hyperpigments or something. And it's just like a little tiny incisions made. The reason that several have to be made in order for the fat to really survive and have a good blood supply and nutrients afterwards is it needs to go in multiple directions. I always think of it as, instead of a donut, I think of it as a honeycomb. And we need all of the fat to be placed like little drops, for the most part, in a honeycomb in different directions from different angles. And so you do get these little tiny incisions around, but I think that they heal really well. In the beginning, it will look kind of red and inflamed. Typically, you'll have bruising because we are kind of going in and out to place the fat. But then over time, it becomes what it was before, just more full.
Yes, they're 2 millimeter, tip of a pencil. How soon after a consultation can we come in for the procedure? We have Avery. She's our consultant, and she's going to be answering some of these questions regarding scheduling and pricing. She and some of our consultants, you also get an email with their information, and they can set you up, depending on what you want. If it's a short procedure, we can fit you in faster. If it's a longer procedure, then sometimes we have to look at our schedule to see what's the soonest that is available for a longer procedure. But for the most part, breast augmentations take 1 hour. We can get those in fast.
Yeah, exactly. Nipple sensation. So what are the chances of losing nipple sensitivity? So immediately you're going to probably lose some sensitivity because we're just doing something to your breast and there's swelling and we're putting pressure behind it and there have been incisions. And some people actually it gets hypersensitive. But overall, I think in general, it's about a 1% risk of having permanent changes. But the sensations that your nipples will be having, either hypersensitive or loss of sensitivity, will continue to develop over time. And I think between around 6 months or so, people start to kind of even out then.
100%. We always have to talk about it because we're going to have to make an incision that is not coming at all. Do you have any suggestions about how to tell my dad that I'm getting my breast done?
Oh boy.
How old are you?
Yeah.
And it depends. What do you think?
Right.
I think men sometimes don't even notice. So
Yeah.
and it depends. Are you an A and you're getting 600 cc's, or are you getting a small implant that people are not even gonna know? Some breast augmentation for some of my patients. You can barely tell that it is an implant, and they wanted just a very conservative augmentation, so they get a baby implant, and you might get away with not saying anything.
So I think that it's a good idea to tell them. You know, I do. As a parent, I would want my child to tell me if they're going to have surgery. But I would approach it more, you know, also depending upon your relationship with them. But for a lot of patients, it's how you feel about yourself. I mean, you know, your dad knows you're beautiful and he thinks you're beautiful just the way you are, but he also wants you to feel confident and happy. And so maybe I would approach it from my confidence. This is where I want to improve. And I feel that this is going to make me feel a little more confident. And just really be honest and with them.
And you'd be surprised when you bring it up to people and you tell them this is something you're doing for yourself. And that it's going to help your confidence and it's something you've thought about it for a while. Most people are going to be very supportive. We, as women, I think, tend to criticize ourselves so much that we think that other people are going to do that to ourselves as well. And for the most part, if you talk to friends, family, anybody that and tell them that this is something that you want to do for you, most people are going to really support you and help you, and it's not going to be that big of a deal to have that conversation, right?
Yeah. One thing I would probably suggest too, though, is, you know, because when you tell him, he's going to bombard you with so many questions, right? And so if I were you, I would have done my consultation, really thought about what you're doing, thought about your sizing, and just really know everything, so that when he's like, well, what size are you going to be like Sally Parton, or wait, where's this happening? And you're just not like, I don't know. And that'll stress you out. And you don't want that.
Definitely. All right. And can we have a consultation with a friend? Like if we're both considering, yes.
Yeah, definitely. I do personally prefer to meet, even if you come together, to meet independently. Otherwise I feel like there's too much conversation and sometimes things are missed, or I want you to have the best individualized experience. And so yes, come with a friend. Usually I talk about the converse together, and then we do one at a time with some things.
Yeah, I think picking implants, you have to be separated. Because then you're going to be like, oh, but what does she have? Oh, can I get that? And then you can actually influence each other's decision and then end up with something that you didn't want. But yes, you can come, we can do most of the talking together, and then we can try implants separately so that each person gets exactly what they want. You don't want to over analyze what other people think about what you're getting. You have to block all of those comments. People that, oh, but I got this one and I got this size and you should do this, because it's not your own personal experience. I tell my patients, you're going to wear these breasts every day of your life. You're going to look at them in the mirror every day. You're going to go to the gym with them. So it has to be something that you want, nothing else, not because it's a trend, not because so-and-so had some specific implant, et cetera, et cetera. So I think picking implants individually. Consultation, we can talk about all things together.
Yes, exactly. Okay, so I think it's time to wrap up. We're really excited that we had this opportunity to discuss about all these issues with you. We wanted to remind you that we have some wonderful specials. We have $1,500 off any breast surgery procedure through the end of the year, and that's with either Dr. Atencio or myself.
So take advantage of this amazing special. And thank you for coming. Thank you for listening to us. Thank you for all of your questions. We really appreciate it. You will soon get emails about the session and about the giveaway. And please let us know if you have any other questions. Feel free to book your consultations online as well. And I think that's it.
Yeah, and you will be getting a text on your phone. And if you're interested in having a consultation, just text back happy. We'll be here for you.
Very nice to meet you.
Yeah.
Have a good night.